Veterinary medicine is a messy business both physically and emotionally. Vetsplaining is one veterinarian's attempt to explain and understand her own profession a little better. Join Dr. Lisa McFaddin as she delves deep into the medical and business aspects of veterinary medicine. I unfortunately frequently hear clients tell me that they think their dog is getting older, and that's why they've started peeing in the house or pooping in the house, or sometimes they seem confused, or they get really grumpy easily, or they're not sleeping as well at night, or they may have lost their hearing. And if this podcast episode does nothing else, I hope that it makes you stop and think that maybe there's a little bit more going on than your dog is just getting old. And in veterinary medicine, we are taught that age is not a disease. And frequently, if there's issues, it's not just because they're getting old. We're going to focus this discussion on cognitive dysfunction in dogs, but it does apply in cats as well, though the cat symptoms are a little bit different. Canine cognitive dysfunction is basically the equivalent to doggy dementia. And we're going to abbreviate canine cognitive dysfunction as CCD, just because it's going to make things a little bit faster. So CCD affects at least 14% of senior dogs, but less than 2% of those dogs are officially diagnosed by veterinarians. And there have been multiple studies that have shown that there are significant similarities between CCD and human Alzheimer's disease. Both canine cognitive dysfunction and Alzheimer's are progressive, incurable degenerative diseases of the brain, and they're known as neurodegenerative disorders. And current research suggests that CCD and Alzheimer's are in part caused by the accumulation of excessive amounts of a protein called beta amyloid. And this protein accumulates in the brain tissue and in the blood vessels of the brain. And the frustrating thing about beta amyloid is they form these kind of they almost look like corrugations. Like if you look at a thick piece of cardboard on the side and you see those little corrugations, that's kind of what these beta pleated sheets are. And they fit on top of each other really well. And they make these really impossible to remove depositions in the brain. And so the amount and the location of beta amyloid deposition correlates with the severity of clinical signs seen in dogs with CCD. So the more beta amyloid deposits, the more clinical signs you're going to see. And if you think about it, if those proteins are depositing in the brain, they're going to be affecting how that brain functions, how those neurons fire, and what signals get sent to what portions of the brain. And so, of course, they're going to cause problems. And so it would make sense that the more that are there, the less normal brain tissue there is, the more signs you're going to see. And studies have shown that dogs with canine cognitive dysfunction actually have less brain mass. So in other words, those nerve cells within the brain have died or shrunken because of the deposition of that protein. And this brain atrophy is likely due to oxidative stress and free radical damage that's caused in part by the inflammation generated by the presence of those beta amyloid proteins within the brain. So not only do these proteins inhibit normal function, but it can actually in part physically damage the brain. The most common signs seen in dogs with CCD follow the acronym DISHA. And we really like acronyms in veterinary medicine. It helps us memorize things, plus it sounds fancy, and we can use it as a way for clients to easily remember those signs. And the acronym stands for disorientation in familiar environments, interaction changes with people and other animals, sleep-wake cycle disturbance, house soiling, and activity level decline. CCD is a diagnosis of exclusion. Unfortunately, there's no great ante-mortem or prior to death diagnosis that's definitive because nobody really wants to get a brain biopsy. And there are other potential causes with signs that are similar to CCD, and those causes need to be eliminated before you can say, yes, your dog has dementia, or yes, your dog has canine cognitive dysfunction. And there are multiple diseases that mimic these signs that are commonly associated with CCD. So we're going to go through each letter of the acronym and talk about the signs you will see in CCD and those diseases that can mimic those signs.
So first we're going to talk about the D indicia, or disorientation in a familiar environment. So the common signs you see are excessive vocalization, barking, howling, yelping, whining. They can act fearful or anxious. They may be trying to hide. They can act lost or confused. A lot of clients will talk about they walk into a room and their dog is just like stuck in the corner, like they're pressing their head against the corner, and they don't really know how they got there or how to get out of it. So diseases that can mimic that are things like sudden vision loss or gradual vision loss, hearing loss, pain, anxiety, and potentially a brain tumor. The I stands for interaction changes, and the common things we find are they're not greeting the owner when they come home, they're not jumping up on the owner when they're not really getting excited, and they may have aggression towards people or other animals. Diseases that can cause these signs include arthritis, pain. Pain can cause a lot of weird stuff, especially because dogs can't say, ow, this hurts. Anxiety can also cause these issues, seizure disorders, and again, brain tumors. Unfortunately, you're going to find brain tumors a pretty common rule out for canine cognitive dysfunction. And really the only way to prove that your dog does not have a brain tumor would be an MRI of the brain. The S indicia stands for sleep-wake cycle disturbance. And so these animals may be awake at night, they may be very restless during the evening, and they may sleep like the dead during the day. And it may be really hard to actually wake them up during the day. They can sometimes spend the evening panting. They may be yawning a lot during the day because they're not getting good sleep even when they are sleeping. They can toss and turn a lot at night, or it may seem like they can't get comfortable. They can't find a position that they really like. In my case, it's usually because I can't figure out what pillow I actually want to use that evening. Pain can cause these signs we're talking about. Hormone disorders, so things that affect the thyroid gland or your adrenal glands, which are those little glands that live above your kidney. Kidney disease, liver disease, those can also cause changes in sleep-wake cycle, and brain tumors. The H stands for house soiling, and the most common problem is urinating or defecating in the house, or urinating or defecating in unusual locations. Sometimes animals, for whatever reason, pee or poop in the house, basically from puppyhood, but they'll start to do it in odd locations, or outside you'll notice that they really only pee and poop in certain areas, which was never a problem before. Kidney disease, liver disease, a stroke-like episode, or vision loss can all be reasons that animals will start to do this in the house as well. There's also other behavior disorders, especially with cats, that can cause them to urinate in the house. The A, again, stands for activity level decline. And so you'll notice decreased playtime with people and pets. They'll have loss of interest in their toys. They may be fearful or phobic of going outside. Or you may notice unusual vocalizations. And again, hormone disorders from thyroid gland issues and adrenal gland issues can cause signs similar to this. Heart disease can cause signs similar to this. Anxiety and pain can be other reasons why animals have a loss of activity level. To diagnose CCD, the veterinarian really needs to discuss the most common signs seen with canine cognitive dysfunction and to see if that fits what your pet's symptoms are. We frequently encourage running baseline blood work, so we check red cells, white cells, platelets, liver, kidney enzymes, thyroid level, and we run a urine test. And part of the reason for doing the urine test, especially if they're peeing in the house, is we're going to make sure they don't have a urinary tract infection, make sure they don't have crystals, so we're not worried about bladder stones, make sure their kidneys are functioning normally, because you use your urine and your blood to tell you about kidney function. And the veterinarian may also recommend chest or belly x-rays, a belly ultrasound, blood pressure, and special eye tests. And all of these are used to rule out other common causes for those DISHA signs. And there are also questionnaires that you can fill out. There's a million of them online, and a few veterinary schools have come up with their own. But realistically, all those questionnaires are doing is they're asking you poignant questions to find out if your animal is experiencing any of those signs we talked about under the DISHA acronym. So once your pet has been diagnosed with canine cognitive dysfunction, we then need to have a discussion about how to delay the progression, because remember, this is a progressive degenerative disease. And unfortunately, like Alzheimer's, they're going to continue to get worse. So while we cannot cure them, the goal is to provide excellent quality of life for as long as possible. And we can achieve that by modifying diet, using medications, using nutritional supplements, also called nutraceuticals. And there's other integrative options that we can consider as well. And so we're going to go through each one of those potential, we'll call them treatment options, but realistically they are supportive options. So there are certain environmental modifications you can make. And those include enriching the dog's daily experience to stimulate the brain to delay nerve loss, right? So you use it or you lose it. And a engaged dog is a busy dog, is a stimulated dog. And so you want to increase their activity level. Even just taking them on a simple 15-minute walk a day can really provide both physical and mental benefits. You also want to increase their social interactions with other people or pets. Now, keep in mind, if your dog does not like either people or pets, that's not going to be super helpful, right? Because it's just going to stress them out. But if they do enjoy the presence of people or pets, then that will help reduce anxiety, especially in new situations, and reinforce positive experiences. You can also do what is called cognitive training. So, they have those apps for people. We don't have an app for dog yet, but you can do things like puzzle toys with treats, puzzle food bowls, scent work, so training your dog to identify certain smells. Next, we have dietary modifications. And the goal of dietary modifications is really to increase the amount of antioxidants that they get on a daily basis. And antioxidants are those substances that reduce oxidative damage, in particular in the brain when we're talking about CCD. So those are things like vitamin A, vitamin C, vitamin E, selenium, zinc, and L-carnitine. There's also other factors that we like to increase in the diet. Lipoic acid, omega-3 fatty acids, which include both DHA and EPA. And we like to increase the amount of usable energy for the brain. And medium chain triglycerides, or MCTs, which I'm sure it's a big thing right now in human dieting. I'm sure you've heard of them. They basically are a very easily usable energy source for the brain, and they can help with brain function. And so the primary options are prescription diets that are formulated for the brain, and those include things like Hill's BD and Purina NC NeuroCare. Additionally, if you're interested in making your own food for your dog, your veterinarian can help you formulate or get in touch with veterinary nutritionists that can help you formulate a homemade diet that will increase those antioxidants as well as medium chain triglycerides and omega-3 fatty acids and lipoic acid in the diet. Next, we're going to talk about pharmaceuticals. So these are actual prescription drugs. And there's three main ones that we think about when we talk about canine cognitive dysfunction. First, and probably the pharmaceutical that's used the most, is the trade name is Anapril, and the generic name is selegiline, and it is what's called an MAOI inhibitor, and it's been shown to improve sleep, improves house training, and activity levels. Potential side effects include restlessness, agitation, vomiting, disorientation, and diarrhea. So some of those are kind of similar to the side effects we see with CCD. In my experience, the most common signs are GI upset. The thing to keep in mind is MAOI inhibitors in general have the potential to interact with a lot of different medications and foods. So that's something that you have to really work with your veterinarian to ensure that we're not feeding or supplementing or using other medications that could cross-react with that drug. Memantidine is another medication that has been shown to reduce the signs of progression of dementia. The last pharmaceutical that we're going to talk about is gabapentin. Gabapentin's trade name is Neurontin, and it was originally invented to help with seizures for humans. Didn't do that great of a job, but they found that it did a great job with helping to reduce nerve pain. And if you've ever heard of Lyrica, that's actually pregabalin, which is kind of like the next generation of gabapentin. And gabapentin can reduce nerve pain and anxiety and improve nighttime sleeping. The side effects are usually limited to sedation, which you see for about the first 2 weeks of therapy, but it can be used very safely long term. And something to think about is a lot of these dogs are older, and while they can have early signs of canine cognitive dysfunction as young as 8 years of age, unfortunately, most of these guys are not diagnosed until they're 11, 12, 13, 14, 15, And at that age, a majority of these dogs have pre-existing arthritis as well. And in arthritis, you get degradation of the cartilage within a joint. The cartilage is covering and protecting that bone, and when the cartilage is no longer there in sufficient quantities, you're going to get bone-on-bone contact, which is basically nerve-on-nerve contact. So utilizing the gabapentin will reduce nerve pain and help make these arthritic animals more comfortable.